I'm Dr. Ben Newman, and this is a follow up to the last video. So, I had a good question from Mary, and I think I answered a related question and not exactly Mary's question. Let's try and answer Mary's question. The other one is good stuff if you're wondering whether a previous COVID infection would affect your need to get vaccinated or would make anything bad happen, like after you got vaccinated. The answer to which is no, but then we explain why. I think your actual question is, if you have COVID right now, will the vaccine still work? Because those are literally the words on the page, and I should read them more carefully, shouldn't I? The answer is we don't know for sure. I would say if you have the option, I would not get vaccinated at the same time my immune system is trying to deal with COVID. What you get after vaccination is like a sorting. So your body has this many white blood cells, and you will go through and actually murder a bunch of the white blood cells that don't really, don't seem to be reacting to whatever it is you're dealing with. And so the number is going to go down a tiny bit. And you're going to be selecting really good ones that will then multiply and bring you right back up to the same level. I don't believe anybody has tried vaccinating during an ongoing infection. There isn't a good way to do it in an animal model, and there isn't a good reason to do it in a human experiment, because most people would not be COVID positive while they're being vaccinated. I don't know of any real harm that could come, but I would say, just to be on the careful side, yeah, I would get a test. And the second half of the question is literally, should you be tested before getting the vaccine? In a place like Bryan, Texas, which, helpfully we know is where this question is coming from. Yeah, if you're associated with the university, there are ways to get tested for free. There may be other places where this can be done. There may be ways where you can get tested through insurance. And I would say, yeah, if you've got the option to get tested right before you get the vaccine, that's a good thing to do. Part of that would be so that you know whether or not the vaccine worked. Because if you start feeling sick, I don't know, 5 days after the vaccine, it'd be nice to know whether or not this is something you probably had before, or whether this is something that you've just recently caught up with. It can maybe help you tell the difference between side effects and actual symptoms of the virus, which have some differences but have enough overlap that you wouldn't always be sure it's one thing rather than the other. So yeah. So nothing in the literature that I know of that says that you can't, but all the same, I probably wouldn't try to get vaccinated while I'm still COVID positive. But that's another thing where there would be people in that situation. Like, there's some people who have had transplants or some kind of immune condition, which means that certain parts of their immune system do not work as well as they ought to. Yeah. And in people like that, a doctor may well decide that this is probably a good idea because their immune system is just not getting the message despite having the virus in there for months. And so, yeah, let's try and vaccinate and knock it out. That would be very much a your doctor kind of call. That's fine. They're allowed to make those calls. They have the knowledge and the liability insurance to do that. And I have neither. Yeah. So there we go. I hope that answered your actual question rather than the one I thought you asked. Yeah, good luck, and here's hoping we all get vaccines soon, or sooner rather than later. All right. Thanks very much. This is Ask Dr. Ben.